And let me say from the onset that it is indeed a pleasure welcoming you to this house um, as the presiding officer. Having spent considerable time working with you in the past, welcome back to this house. Good afternoon to the other members of the house, and special good afternoon to those who are listening to us, those who are viewing us via the many social media options. Mr. Presiding Officer, I'll be honest about this one because even though I am extremely proud of my colleague for bringing such an important motion that is important and timely, I actually found it a little difficult preparing for today's session because I was afraid that exactly what has happened is what would have happened as relates to the debate. Mr. Presiding Officer, we have an opportunity now to spend the afternoon critically analyzing what we've been doing, particularly since we know for a fact that there are deficiencies in the system. My colleague, the member for Palatavere, Lansome Speyside, started his presentation by speaking about all of the things that we are doing. So by no means did anyone say that we're doing absolutely nothing as it relates to this issue in Tobago. But the fact remains that having spoken to the very staff members that we are congratulating and having spoken to some of the clients that we are trying to serve, it is a fact that even though we are doing something, there is always an opportunity for improvement, and we should take the time to work on those things. Instead of simply coming and just highlighting that we are doing everything and everything is wonderful and everything is great, when those on the ground, the staff members, and the clients that we serve know that that is not the truth. Mr. Presiding Officer, as the motion starts, it is October, which is Mental Health Awareness Month. And given that it is 2020, which seems to be the year of Oh Heavenly Fathers, we know that the stresses and strains of COVID-19 makes our mental health, or makes us maintaining good mental health, a little bit more difficult than it has been in previous years, Mr. Presiding Officer. And we also know that when we have difficult mental health issues, that one of the things or one of the mechanisms that we use is to use substances to help us to cope. Though we do not have, I do not have data on the link between the number of mental health patients who are substance users or substance abusers who have mental health issues in Tobago. And I would have loved if we had that data so that we could really say that when we are acting from evidence, because we need the evidence to make certain kinds of decisions. International data, data from other areas, including data from the National Bureau of Economic Research, indicates that within the US, for example, between 35, 38 to about 45% of the alcohol, of the cocaine, and of the cigarettes and so forth that's consumed is actually consumed by individuals with known mental health issues. As a result, Mr. Presiding Officer, it is important for us, and this is what the motion is really asking us to do, to recognize that it is difficult for us to separate these two things, and that we need to take a little bit of time to think through how we can comprehensively, cohesively work together to treat with the mental health issues, to treat with our substance abuse issues. And because those two things together tend to result in the street dwelling issues that we have, we need to look at this comprehensively. Which is why, if you go back to the wording of the motion, as much as it seems as if we were trying to make us look bad, what we are really doing is to ask that all of us collectively, understanding the relationship between the Tobago House of Assembly, understanding the relationship with the Tobago House of Assembly and the TRHA, and understanding the need to use our NGOs and other external entities, we need to collectively work together to try to deal with these issues. Collectively work together to comprehensively come up with a program is not the same as just saying, we're doing this, we're doing that, we're doing this, we're doing that, we're doing this, we're doing that, we're doing this, we're doing that in a hodgepodge kind of way. Doing a million different things but not thinking through how we work them together does not make it a comprehensive system. As a result, Mr. Presiding Officer, I would like to suggest that as we go through, and when I'm speaking to the members in here, but I'm also speaking to the members who are professionals, but I'm also speaking to members who are clients, members who are part of NGOs, CBOs, and so forth, so that when we are working through how we could treat with mental health issues and substance abuse, we do it collectively. There's a particular model that speaks about the fact that we need to have at least 7 different components of a comprehensive system. Now, these components don't all need to be provided by the same people or by the same entity, but collectively working together, we could get success. And Mr. Presiding Officer, I'm going to ask you to indulge me a little bit to go through each of these 7 really quickly so that we all know what I'm talking about. The first includes having a screening, assessment, and referral system, Mr. Presiding Officer. And as this says, it means that we are not necessarily waiting for clients to come to us, as is suggested, but we are seeing the need, and we have a system of actually going out and reaching the clients who need the service. So it may be just passing along the street. It may be having a church or a school or any community organization say, hey, I noticed this is happening. I noticed this person is on the street. I noticed this member of my family needs help or whatever. And they know there is a particular number, there's a particular system that they can reach out to so that they get the help for those that are needed, for those in need. Of course, once the person is identified, there must be an internal mechanism to identify whether the client actually has mental health and or substance abuse issues. And if we recognize within the system that we cannot treat with the needs of the client, then there must be a very rigid mechanism for referring out. The second component deals with physical and mental health consultation. Because what we frequently recognize is that in many of the services that provide one kind of service, they only look at that particular type of service. So we need to ensure that, let's just say we have a residential space that provides for substance abuse treatment, that within that residential space, the facility can do both mental health assessment and physical health assessment to ensure that we are treating with the entire patient, the entire client who needs our services. Again, if the services that are needed are not available in-house, it's important to figure out how, who, what, when, where, and why to have that call. Now, one of the things you recognize is that when you talk to professionals, they are the ones who tell you that, yes, I have a patient with this issue. I can only treat with this part of the issue, but I don't know who else to call. I don't know where to send them. I don't know. And this is coming from the workers, this very employees that we are talking about. Now, when the employees within the health system, within the mental health system, tells you that they have patients who are dealing with substance abuse and they now don't know what to do with them, given that TRHA is not available, then it means that even if they are halfway houses externally somewhere else, that information needs to be circulated widely so that those who need the information, those who are in the position of know, those who have the clients, they know that there is this other place that they can send their patients. What is also recommended, because there is this understanding that there are these co-occurring issues, is that if we have a substance abuse program, it is critical to have on-site psychiatric care at the substance abuse facility. Now, this has been proven. There have been several studies that show that adding specific on-site psychiatric care improves the overall outcome of the patient because it takes away several barriers. One of the barriers it takes away is having to go off-site for care, because when you have to leave where you are, where you have probably now been comfortable with the staff and with the process, to then have to go into another system, it makes it a little bit more difficult. Now, in Tobago, we have the benefit of this island being relatively small. So even if we have to move from one place to the other, the physical distance may not be as difficult. But we have to ask ourselves whether the referral process and the transferring of patients and the moving through the system, whether that is as easy as it needs to be. Again, Mr. Presiding Officer, by no means am I saying that it does not exist at all. I am just saying that we need to critically review what currently happens to see if it is the best that it can be, and then put steps in place, put systems in place to make it the absolute best that it can be. We also know, Mr. Presiding Officer, that particularly when it relates to, because of the stigma associated with mental illness in Tobago, in Trinidad and Tobago, in the Caribbean, if you have a client who is willing to go into a residential substance abuse program, for example, it is difficult to then ask that patient to then have to go to a mental health clinic, because they see that as labeling them as having a mental health issue. Now, the reality is they do have a mental health issue, but it is that stigmatization, that labeling that becomes the issue. Ideally, the facility should hire a psychiatrist with substance abuse expertise to ensure that we have that good working relationship within the system. A facility like this, Mr. Presiding Officer, should also ensure that there is a mechanism to provide the medication that is needed and to monitor the medication use and effects. Ideally, having the actual whatever medication is necessary on site would be great. If it is not available on site, again, having a mechanism where the client does not have to go get it, but it can come to the client is the best that is recommended. In addition to having the process internally to ensure that there is actual adherence to the medication, to look at the side effects, because we all know that the side effects of some of these drugs are actually pretty difficult, and that prevents people from taking the drugs, and to look at the overall progress of both the mental health and substance use, substance abuse issue that the client is treating with. Another component that is critical is having psychoeducational classes. And these psychoeducational classes are basically classes that keeps the client in the know. So we are talking about we're talking about information about what their illness is, whatever it may be, the signs and symptoms of their illness, information about the medication that is necessary, about the side effects that the medication may have. It also includes them having very honest conversations and honest information about everything surrounding their diagnosis. Because we know that when we give accurate information, particularly up front, we are more likely to get greater adherence, and we are more likely to have them come forward when there are issues that they need to talk through. Mr. Presiding Officer, programs like those can also assist the clients with identifying what their triggers may be and identifying how they can work around their triggers instead of medicating or self-medicating the way they traditionally have done. Another thing that I would strongly recommend, or that is strongly recommended with this model, is to have what are known as double trouble groups. Now, when you say double trouble groups, we are talking about groups where they sit, group sessions within the facilities, where they specifically speak about the fact that, yes, we do have mental issues, and this is how they manifest. But it also is able to have them work through how the mental issues affect their substance use. So you may have candid conversations about the fact that you may have hallucinations, or you may be hearing voices, and the voices are telling you to do this. And one of the things that makes the voices go away is when you smoke or when you drink or those kinds of things. So there is a very clear connection between the two, so that you know that we are treating you as a holistic human being, because these two things interact with each other, and when we treat one, we have to treat the other. And the final component of those kinds of programs that we would suggest, Mr. Presiding Officer, is to have, in addition to the on-site double trouble kinds of session, is to have those off-site dual recovery self-help groups. And this is where, for example, Mr. Presiding Officer, we could closely work with an NGO